Hello, and thank you for joining us for this important conversation about COVID-19, the vaccine, and the future of the pandemic. I'm Karyne Jones, President and CEO of the National Caucus and Center on Black Aging, NCBA, and a co-convener of the COVID-19 Vaccine Education and Equity Project. To kick off today's discussion, I'm honored to be here with Dr. Rochelle Walensky. Dr. Walensky serves as the Director of the Centers for Disease Control and Prevention and the Administrator of the Agency for Toxic Substances and Disease Registry. Dr. Walensky, thank you so much for spending time with us today.
I'm so delighted to be with you, Karyne. Thanks for having me.
Great. So, what can we tell people to expect life to be in the next 3 to 6 months, and how the vaccination rates impact that outlook?
This is so critically important because people really do want to put this pandemic behind us, right? That people are tired. We need to be in a position where we're no longer in crisis and we're learning to live with the virus. And so what does that mean? That means that we have immune protection. We'd love to be able to get to that immune protection through wide-scale vaccination, and we've made huge strides in being able to do so. Some people have protection because they've been infected before, and we know we can increase that protection if they also get vaccinated. But as we look at living with COVID, that is going to be having some protection, continuing to use some of our smart prevention measures, and then having treatments that are accessible to us because there are so many treatments now that we have that we didn't have before to rescue people who might get serious disease despite the protection in the background. We are looking towards what that's going to look like in the months ahead. We're not quite there yet, though. We continue to have about 300,000 cases a day. Our hospitalizations are still quite high, and our deaths are still at around 2,300 per day, which is still higher than our peak time during our Delta surge. So while we are looking at what 3 to 6 months might look like, we're not quite ready to release those mitigation strategies, those measures, and we need to continue to do the hard work of getting people vaccinated, getting our young people vaccinated, as well as getting people who are eligible boosted, because that will increase protection.
Well, yes, just as you mentioned, as we approach that 2-year mark of COVID-19 pandemic, I tell you, people are really experiencing fatigue and, a sense of information overload. We've certainly experienced that ourselves, and we understand how challenging it is. So what lessons have been learned at the CDC, and you as the agency leader, in applying to communicate and working to communicate with people about key public health guidance and ways that can easily be understood by the general public?
Right. Really critical question in this moment. So this last 2 years, the science has evolved, the variants has evolved, the disease has evolved, and we've had to make really important public health decisions, sometimes when the science was gray, sometimes when we didn't have all the information that we wanted to have. And when we make those decisions and we update our guidance, we do so because it is on the backdrop of science and new information. We understand the epidemiology of the disease and what might be coming, what new cases might be coming as we anticipate a surge, and then what's feasible, what is doable, what can the public do. And so as we update our guidance, we do so with those 3 pieces of information at hand. One of the challenging pieces has been how we make guidance that is general enough so that it can be applied to New York City and rural Montana and Indian country, which is our responsibility, and yet have it be specific enough so that people can get their questions answered, such as, well, what about me? I'm immunocompromised and I'm going to send my child to school. How do those guidances apply to me? So it would be relatively easy for us to say, everybody mask, everybody get vaccinated, everybody isolate for 14 days, everybody get tested. But people really do want to adapt that guidance to their specific situation. And that leads to us putting out nuanced guidance for many of those situations if they become more complex.
Well, we know now children as young as 5 currently are eligible for the COVID-19 vaccination, and potentially the authorization for younger children is on the horizon, which is good news. What do you want parents to understand about the safety and the effectiveness of the vaccine? And are there long-term impacts to consider from infection or a children's role in transmission, especially regarding their grandparents and to other, vulnerable populations?
Really important in this moment. So right now we have about 22% of our children between the ages of 5 to 11 have received their primary series. About 56% of our children between the ages of 12 to 17 who've received their primary series. And it's so very critical that we get those children vaccinated so that they will be protected not only from infection, but also severe disease, and protecting their household, and even protecting their younger siblings who are not even eligible to be vaccinated yet. The safety record of these vaccines is truly unprecedented. We now have over 215 million people who've received their primary series, and we have billions of these doses that have been administered across the world. What I can tell you through this pandemic is that we have bolstered our safety systems for vaccine reporting. We have the vaccine adverse event reporting system. We have a passive vSafe reporting system. We have an academic reporting system, our vaccine safety data link. We now have a new system that maps pregnant women with their babies and then follows them up after 3 months of having delivered to understand the safety and pregnancy. And we've been very transparent. All of these safety data are presented in public sessions of our advisory committee. They're available online if you want to see a review of the safety data. I'm really pleased to say not only do these vaccines work extraordinarily well, but they're extraordinarily safe. And in our last public review of millions of doses of vaccines given to children, we've been able to say that the most common side effect was a sore arm. And in fact, extraordinary safety. Some children are getting fatigue, some children are getting headaches, several are getting sore arm, and fevers sometimes occur. But in terms of severe adverse events, we are not seeing them for these young children.
That's good to know. Now, you know that Black and Latino communities have been disproportionately impacted by COVID-19. Which really underscores that long-standing health disparities that exist in this country for underserved populations. Looking ahead, Dr. Walensky, do you think there will be lessons learned from this COVID experience that we can use to help to bridge these gaps?
On April 1st, just a few months into my tenure as the CDC Director, I declared racism a serious public health threat. That was not only true for COVID-19, but for many diseases, for maternal mortality, for chronic diseases. And this is because we have seen time and time again, and we saw it shine brightly in COVID, bright light on it in COVID, the disparate impact of racial and ethnic minorities from the COVID pandemic. We've had over 75 million cases, nearly 900,000 deaths, and 87,000 deaths in the Black community. We know that many of these challenges have been related to longstanding discrimination, racism, historical disenfranchisement, and now is the moment that has to stop. Now that this light has shined on this challenge for the rest of the world to see, it has to stop. And so we're working hard to use this moment to pivot and make sure that we have public health workers who are working in communities, making sure that the communities and public health workforce is as diverse as the communities that they serve. We're looking at trusted messengers and trusted partners. We're looking to you to help communicate and inform your people for whom you are a trusted messenger. And yes, absolutely, we need to do better. And I'm committed as the CDC Director. Our agency is committed to doing better, and we look to your partnership to help.
And you certainly do have that partnership along with all of our other over 200 partners who are part of the COVID-19 vaccination and education project. Dr. Walensky, is there anything else you'd like to share with us?
Maybe I will just share how in the context of that work, we have been able to have equal vaccination rates for our primary series for our adults. This has been an extraordinary work, and I know you have been part of that, so we thank you for that. That we have the same rates of primary series in our white communities as our Black communities, as our Hispanic and Latino communities. And yet, in this moment, while we've been able to get there with our primary series, we have not gotten there with our booster doses. We have not gotten there with our pediatric doses, and we still see this discrepancy in percent of our population that are boosted and are vaccinated among our young. So please, as you continue to do the work with us, and we are grateful for that, those are areas we're really working to make sure that people with Omicron are protected, and that means getting a booster dose.
Great. And we certainly will continue to work because it's important for all of us. Dr. Walensky, thank you again for joining us today. I know there are no shortage of questions about COVID-19 vaccination that many of our partners have, but we are so grateful both for your time and your efforts. Thank you.
Thank you so much.